Hello, I'm Dr. Pranav Kumar. I'm a senior consultant in neurosurgery at Indraprastha Apollo Hospital. I've been practicing here for last almost about 26 years, and I must say that a lot of contribution is by my nursing colleagues, to whom I really wish a very happy Nurses Day, which is just few days away from me today. Nurses have contributed. It is thought that nurses contribute only in the well-being of patients, but in my experience, they have contributed in making me what I am today. I remember the very first day when I joined as an intern at Banaras Medical College. It was a nurse who taught me how to give intramuscular injection, and she also demonstrated to me how to give correctly an intravenous injection. And I still remember those steps, the painstaking way she demonstrated to me how to correctly insert a needle and then puncture the vein and withdraw the blood sample. So that is the oldest memory, a very fond memory which I have about how to give an intramuscular or intravenous injection. Subsequently, after my graduation and post-graduation training, MCH training at Banaras in neurosurgery, I moved to Hinduja Hospital. I remember very distinctly, it is etched in my mind. I was assisting my boss, and at the end of it was a microscopic surgery. At the end of the surgery, the OT nurse came to me and she asked me, "It seems you are not used to microscope." I asked her, "How do you know?" She said, "No, you looked very clumsy and uncomfortable." She could make out from my body language that I was very uncomfortable and I was clumsy using the microscope as an assistant. She said, "Okay, come after 15 days. It's my night shift. I'll take out the condemned micro set of instruments and bring 2 oranges." And I kept wondering, why does she want me to bring 2 oranges? Anyway, 2 weeks later, I reached their OT at about 11 o'clock in the night. She opened the neurosurgery OT, and with the whole set of condemned instruments, micro instruments, she said, "Okay, peel the oranges and now take out the seeds under microscope using these micro instruments without damaging the pulp of the orange." And over the next about 10 nights or 15 nights, I kept trying that, and that is how I was initiated into microscopic surgery. I'm still so very thankful and grateful to that. Francis was her name, and I think the very foundation of my microscopic neurosurgical training was laid there. There are many such instances which I can quote, and which have happened in my life, and I'm sure every surgeon, every physician would be able to recall such instances in his or her life where the nurses have contributed in shaping the medical skill or surgical skill of either a neurosurgeon or a physician. We as doctors tend to forget all these instances, and we don't ever tell the patients that, look, the nursing care has also contributed immensely in the surgical outcome or medical outcome. I think that we are there only for about 5 minutes or 10 minutes, once or twice in a day. It is the nurses who are there for 8 hours or 10 hours, continuously working with the patient, helping them, understanding their problem and trying to sort those out. It is the nurses who deserve credit for their unflinching care of the patient. This should be appreciated more widely and should be conveyed to the patient, so that not only the doctors but the nurses as well should be aware and complimented by not only the doctors but also by the patients. Thank you very much.